We're recording. All right, we are live on Facebook. Hello, everyone. Welcome to the InVINcible Health Series with Dr. Vin. I'm here with Dr. Vin, and my name is Krista Gervon. I'm the Communications Director at Princeton Integrative Health. And today, sorry for being a little bit late today, but today we're going to be talking about the Delta variant of COVID-19. Here we are about a year and a half plus later, and we're still talking about this virus and now its mutated versions. So we're going to jump right in and talk about the Delta variant. Dr. Vin, can you tell us why Delta seems like it's worse than other strains of COVID-19?
Yeah, so it appears that Delta can actually replicate more quickly. So it's more infectious. And so people are getting it quicker. They're building up viral loads more quickly. Viral loads have been seen to be maybe even many times higher than viral loads in the other variants. So they become more infectious, and they become more infectious more rapidly. So I think that if it's not already the dominant strain in the world, that it will soon be the dominant strain in the world.
And is that what makes it more transmissible as well, the viral load?
Yes, well, that's part of it for sure. But it also it binds more easily to the protein called ACE2,
Right.
that allows it to transmit more effectively than the other variants.
And are there any other differences about the Delta variant as far as other strains go?
Well, I said it carries that, can bind more easily. It has a genetic mutation that allows it to bind more easily. Mm-hmm. Again, the viral loads are higher. Some reports are that they're 1,200 times greater than the other variants. So, and also it's potentially because of the viral loads, we think it's might be more virulent than the other strains, causing increased hospitalizations. There's no indication yet that it's causing more people to die, fortunately, but more people are being hospitalized than with the previous strains.
And is it more likely to infect those who are already immunized against COVID-19? So those who are vaccinated or those who have had the virus already?
Yeah, it does seem like it is more able to infect people who have already been immunized. They can do things like check neutralizing titers, the titers that give the protection. Mm-hmm. And the neutralizing titers are not as good against the Delta variant as they are against the other variants. So, that's I think part of the reason why even fully vaccinated people are more likely to get infected with it.
We're seeing a lot of those breakthrough cases. It's more likely that it's Delta than anything else.
Yes, definitely. It does seem to, the immunization does seem to still offer more protection against the severe forms of the virus, having to be hospitalized if you're immunized and, death, but you can still get a breakthrough infection, still not as severe as people who are unimmunized. And
still can spread it too, correct?
And you can still spread it, yes. So if you're immunized and you get a breakthrough infection, you can still spread it. There's indications they don't think you're infectious for quite as long, but that has resulted again in the recommendations for face masks if you're indoors, for example, and especially if it's poorly ventilated, because number one, you can get infected. And number two, you can, once you're infected, and become symptomatic, you can spread it. So that's why they seem to relax the face mask requirements for a little bit, but now they're they're re-emphasizing them because of this Delta variant.
Yeah, and we are seeing that it's becoming more prevalent throughout the country. I mean, we are seeing cases rise throughout the nation. So, can you tell us a little bit maybe why that's happening, or?
Yeah, again, number one, yeah. I mean, since we're just talking about immunized people, you can get, even immunized people can get that.
Yeah.
And if people are unimmunized, it seems about, early indications are it's about twice as transmissible as the other strains. Excuse me, for the reasons that we talked about.
Yeah.
That, the higher viral loads and that kind of thing.
Right. So, okay. So we have all this great information from you, and we can understand the Delta a little bit better. Now, what does that mean for us in our daily life? What can we do to continue to protect ourselves, our community, our kids, obviously? What's your recommendation? Where do you stand?
All the things that we had been doing, if you're in an indoor place where you might get infected, then you should wear a mask. For those who decide they, want to decrease their chances of severe hospitalization, and being on a ventilator or dying, then, if they feel they're in that risk group, then they should get immunized. And if they're not immunized, then they can go to places like FLCCC.com and see what the recommendations are there, because they're a group of physicians, and I've recently joined there, that a group of physicians who are dedicated to preventing the illness and to mitigate illness once people get infected and have the virus. So, people can check on that also.
What was the name of it again? And if you could give us what it stands for, actually, too.
So it's the acronym is FLCCC, and that stands for Frontline Physicians for COVID Critical Care. Great.
We do have some people watching on Facebook. Marissa wanted to just let us know, thankfully, that the micronutrient profile done at our practice found that she was deficient in vitamin D. So she was able to increase that, because we know that, when you have a high vitamin D levels, that helps you in your fight against COVID. If you ever have any other questions, please feel free to write them in the chat or give us a call, as Marcia, please do. Our number is 609-512-1468. Also, you can email us at info@princetonih.com. We are obviously available if you have any questions about COVID, any of the strains, and the treatments that are available.
Let me just let me give the supplements that are recommended for, at least for prevention for people.
Sure, please.
So vitamin D, they recommended up to 3,000 international units a day. I actually, for most of our people in our practice, I take that up to 5,000 units, especially when they're at risk. Vitamin C, 500 to 1,000 milligrams twice a day. Quercetin, 250 milligrams a day. Zinc, 30 milligrams a day. Melatonin, 6 milligrams before bedtime. Take it at bedtime because it makes you drowsy, but in this case, melatonin is being used as an antioxidant and immune modulator, not for its sedating properties. And to get a mouthwash such as Scope, Act, Crest, or Listerine with essential oils, and gargle with that twice daily.
Okay.
So that's kind of the natural supplement protocol for prevention that they are recommending, and they can find that again on FLCCC.
I'm gonna put it.
I guess it's FLCCC.net, maybe it's not .com.
FLCCC is the organization.
Yep.
Let me just check the website really quickly. Anything else you want to add about the Delta variant that might be helpful for anyone? Not seeing your website, but
Yeah, don't get it.
avoid it at all costs. Be careful out there.
Yeah, I've talked to a few people who have gotten infected, though, even though they were immunized, and they weren't fortunately seriously ill, but they were not feeling well for sure.
Yeah.
So, and then yeah, some people who haven't been immunized who have become infected. So.
Yeah. Well, please again call our office if anyone has any questions or would like more information. Again, the number is 609-512-1468. And if you want to email us, it's info@princetonih.com. And I hope this was very informative. We have a lot of viewers on Facebook right now, so hoping people maybe share this with others that may have questions about the Delta variant or may just need information. So this again will be up on our YouTube page in a few days, so that it will be available, and also, of course, on our Facebook page for anyone who wants to see it in the future.
No other questions on
other
Facebook?
questions on Facebook? I don't think so. But
okay.
Thank you all for watching, and we will be back here next week, and we will share some new information on another topic, and we'll let you know what that is as soon as we can. Thanks, Dr. Vin.
Okay, Krista. Talk to you soon.
Have a great night. Thanks again, everyone.
Bye-bye.
Bye.